Hi guys, I'm Megan. I'm here today to talk to you guys a little bit about child abuse, the long-term psychological effects, and some of the treatment methods to help cope with that. Tammy Caruso, in a March 2017 issue in One Step Away, said the first case of child abuse was reported in 1874. Tim Carpenter, he is a journalist for the Topeka Capital Journal, published on March 3rd of 2018 that the child support caseload is expected to increase from 140,000 in 2017 to 147,100 in 2018. Child abuse causes a lot of long-term psychological effects that are going to need some treatment to help cope with your life. I think that this is beneficial because some people may be in careers where they're mandated reporters, others may be looking into careers where they're mandated reporters, and some may be looking into like fostering or adoption. And I also just think that it's kind of an important thing to know. So the first thing we're going to talk about is the different types of child abuse and how to recognize some of them. In The Truth About Abuse, published by John Haley and Wendy Stein in 2005, they define abuse as any pattern used to hurt or control a person. Physical abuse, in The Truth About Abuse, is also described as strength, weapons, or threats to injure or hurt someone to gain control. Examples of that would be punching, shoving, hitting, biting, shaking, etc. Children who have been physically abused may be wary of people, especially adults, exhibit aggressive and withdrawn behavior, be manipulative, have low self-concept, and have unexplained injuries. Becca Cohen Johnson in For Their Sake, published in 1992, defines neglect as a failure to provide for your children. Most often it's going to be shelter, medical needs, supervision, and clothing and those sort of things. People who are neglected may be truant or tardy to school, they may beg or steal food, they'll be dirty, inappropriately dressed, and have unattended physical problems. Becca Cohen Johnson in For Their Sake in 1992 describes emotional abuse as an act that endangers the mental health or emotional development of a child or an individual. To do that, you're going to control every aspect of their life, isolate them, or use blackmail. Those children are pretty typically eager to please, anxious, they'll set unrealistic goals, they'll be impatient, have sleep disorders, they might wet the bed, be hyperactive, and they'll also experience developmental delays. Becca Cohen Johnson also says that insults, name-calling, and threats to harm you or the people that you love are verbal abuse. You may also experience unwanted criticism and yelling. And those, in The Truth About Abuse, those are, they describe it as words that are going to hurt you or to control others. The Truth About Abuse describes sexual abuse as sexual behavior to control another person. So examples of that would be sexual jokes, demands for sex, unwanted touching and rape. Those people may be reluctant to change in front of others, withdrawn, have unusual sexual behavior, manipulative, self-conscious, they may be fearful and anxious, and promiscuous, and they may have trauma to the genital area. So now that we've defined abuse, and you have some indications to recognize it, we'll learn about the long-term psychological effects. Deb Larson is a social worker that I interviewed, and she says that abuse causes a lot of similar long-term effects in people, but you have to remember that each child processes trauma differently. PTSD is one of the main and larger emotional factors that these children experience. And it's a severe response to the trauma event where they reenact or re-experience the abuse by flashbacks, nightmares, etc. They'll have sleep difficulties, they'll be detached and aggressive, they'll have an increase in daily stress, and they'll have the intense emotional response to what they perceive as a threat. Physical, emotional, and verbal abuse all will exhibit low self-esteem, they'll be passive, they may become a bully, they'll throw some tantrums, they'll be aggressive, they'll have slower development with walking and talking and growth, low school performance, and some sensory processing disorders. As said earlier, the sexual abuse, they'll have the fear and anxiety, they'll avoid certain places and people, they'll have the low self-esteem, they'll act out sexually, may have a sexual disorder, and they may revert to substance abuse in adulthood. Now that we've evaluated abuse, the long-term psychological effects, Here's some treatment methods to help cope. Cognitive behavior therapy basically just changes the words that causes certain behaviors and emotion. So you're changing your thinking and your feelings about that traumatic event. Exposure therapy, you focus on the trauma that caused the PTSD to gain control of that fear and distress. So you can cope with the negative and anxious feelings and manage anger and deal with the stress that's caused by that. The brief psychodynamic therapy focuses on the emotions caused by PTSD. So you can have an increase of self-esteem and help you cope and you'll have stress your level will go down and you'll just feel overall better. Group therapy is exactly what you'd think. It's a group of children meeting together and just discussing what has happened. And then you have EMDR, which basically you'll use other factors like hand clapping or something, move your eyes back and forth because it allows you to process those things easier. And then most children, hands-on play is the best. Now that we've gone over the child abuse, the indicators, the long-term effects, and treatment, I hope you guys learned something. I hope you guys can take this home and experience, share this with your family. And I personally have watched 2 children grow into amazing people that started out with a very, very difficult life. Once again, I thank you guys for your time.